How can Ms. pain be confused with other illnesses? Imagine experiencing a strange burning sensation or sudden stabbing pain and wondering what's really behind it. Multiple sclerosis-related pain can be tricky to identify because it shares features with many other health conditions. Ms. pain mainly comes from damage to the central nervous system, which includes the brain and spinal cord. This damage causes nerve signals to malfunction, leading to different types of pain that can look like other illnesses. One reason Ms. pain can be confusing is because it can be neuropathic or musculoskeletal. Neuropathic pain happens when nerves are damaged, causing sensations like burning, shooting, or electric shock feelings. For example, relapsing-remitting is a shock-like sensation that occurs when bending the neck. Musculoskeletal pain, on the other hand, results from muscle weakness, spasticity, or abnormal posture due to nerve damage. These types of pain often overlap with symptoms seen in other neurological or orthopedic conditions, making it hard to tell what's causing the discomfort. Ms. pain can also resemble other demyelinating disorders like neuromyelitis optica spectrum disorder or acute disseminated encephalomyelitis. These conditions can cause similar pain syndromes because they also involve damage to the nervous system. For instance, neuromyelitis optica often causes severe, persistent pain due to spinal cord lesions that disrupt sensory pathways. Since these disorders can look alike on scans and in symptoms, doctors need careful evaluation to distinguish them from Ms. Many symptoms of Ms., such as numbness, tingling, weakness, or visual changes, can mimic other illnesses like stroke, peripheral nerve problems, migraines, or even mental health issues. Fatigue and mood swings are common in Ms. but also appear in many other chronic conditions. This overlap can make it difficult to pinpoint the exact cause of pain or other symptoms. The episodic nature of Ms. symptoms adds to the confusion. Flare-ups or worsening symptoms can come and go or be triggered by temperature changes, which can resemble conditions like migraines or transient ischemic attacks. Because of this variability, both patients and doctors might initially think the pain is caused by something else. Diagnosing Ms. pain isn't straightforward. It involves a detailed medical history, neurological exams, MRI scans, and sometimes spinal fluid tests. No single test or symptom can definitively confirm Ms. pain alone rarely provides enough evidence for diagnosis, so doctors look for other signs of central nervous system damage to make an accurate assessment. It's also important to recognize that neuropathic pain occurs in many diseases, such as diabetes, shingles, or spinal cord injuries. Since MS-related nerve pain shares these mechanisms, it can be mistaken for other nerve conditions without supporting evidence from imaging or clinical evaluation. For patients and healthcare providers, understanding these overlaps emphasizes the importance of thorough testing and careful clinical judgment. Recognizing specific features like trigeminal neuralgia or relapsing-remitting can help point toward Ms. Being aware that Ms. pain can exist alongside other health issues ensures a comprehensive approach to treatment. Proper diagnosis helps avoid unnecessary or ineffective therapies and guides appropriate management. In summary, Ms. pain can be confused with other illnesses because it manifests in many forms that resemble symptoms of other neurological, inflammatory, or musculoskeletal conditions. Accurate diagnosis depends on detailed clinical assessment, imaging, and understanding the unique features of MS-related pain. Always consult healthcare professionals for personalized evaluation and treatment options.